comparative analysis of the financial implications and insurance package benefits of the three funds under SHA vis-a-vis the defunct NHIF for individuals in the formal and informal sectors. 2, what is the justification for the mandatory migration of details of NHIF contributors to SHA, and could the CS outline any measures put in place to ensure that data protection laws were not violated in the process? Part C, Mr. Speaker, could the Cabinet Secretary explain the measures put in place to guarantee comprehensive year-round health coverage for entire households to prevent depletion of insurance package benefits by individual members? And lastly, what challenges at NHIF, and this is the part that is key, necessitated the transition to SHA? And could the CS explain the rationale behind the establishment of those funds so that Kenyans can understand? Thank you, Mr. Speaker.
Proceed, Cabinet Secretary.
Sorry, Honorable Speaker, I thought I was answering both questions asked by the Senator, 22 and 30. But let me now answer 30. The Social Health Authority is established under the Social Insurance Act 2023, which this House has passed, and which repealed the NHIF Act number 9 of 1988. The Social Health Authority has three funds: the Primary Health Care Fund, the Social Insurance Fund, and the Emergency Chronic and Critical Illness Fund. These funds ensure the full spectrum of health care is given attention from the point of prevention, promotion, curative, rehabilitative, and palliative care. Honorable Speaker and members, from the onset, allow me to state that in terms of access under SHA, Kenyans can access free primary care by just registering as a member. For NHIF to access any benefits, one had to register and pay monthly premiums, leaving those who have not paid with no benefits for them. And in this regard, accessibility of primary health care to all Kenyans who have registered or with registration will address up to 70% of the health burden under the universal provision of primary health care to ensure that in totality we attain full universal health coverage. Let me make it very clear, Honorable Speaker, that from level 2 to level 4 of the primary health care, Kenyans, all they need to do is to register. It's free. You can walk to any dispensary. You can walk to any health center. You can walk to any sub-county hospital. As long as you are registered with SHA, the government of Kenya, through a budgetary allocation, will pay for it. And we are working around the clock, and I will answer, I'm sure members will ask me. We are increasing the refill of KEMSA to 100% so that Kenyans need to go to these centers. And all that they need to do is, once they are treated, that facility will bill the Social Health Insurance Authority. Honorable Speaker, allow me now to highlight on the specific benefits of the three funds as compared to NHIF on various benefits categories provided under each fund. And let me start with the Primary Health Care Fund. In the Primary Health Care Fund, let me pick on the outpatient services. Honorable Speaker, in relation to outpatient services, SHA focuses on preventive, promotive, curative care services, and palliative care. Members are not limited and can access health services within the primary care network. There is no need to pre-select your health facility. You don't need to select. You can be in Kisumu, and the next day you are in Kakamega or in Garissa and visit any health facility as long as it's registered with the SHA. So there's no need to pre-select health facility, as the patients are free to go to any SHA contracted facility when they fall ill in any part of our country. Comprehensive services provided include health education, diagnosis, treatment, essential laboratory investigation, basic radiology, and chronic disease management. Honorable Speaker, comparing this with the defunct NHIF, NHIF only focused on curative care. And I've said earlier, this now has changed. We care more about promotive, preventive, and rehabilitative care. So NHIF was only dealing with curative care. Access to service by the former defunct NHIF was limited to a specific choice of a facility, therefore, limiting the members or our citizens from accessing services in case they fall sick when they are away from their selected facilities or facilities of their home counties or home constituents or wards. Services are limited to 4 visits per card per year in particular facilities, and to basic services such as consultation, laboratory investigation, and only minor surgery. That was what was in the previous NHIF. From the foregoing, Honorable Speaker and Senators, undoubtedly, the Social Health Authority offers a broader range of outpatient services with the focus on comprehensive care, making it more valuable for managing chronic conditions and preventive care. Honorable Speaker and members of the Senate, let me go to the optical services. In the respect of optical services, SHA provides a more comprehensive optical care package with a focus on preventive and corrective services, making it more beneficial for the long-term eye health management of our people. Honorable Speaker, the services will now include eye health education, eye examination, basic eye medication, and if need be, eye surgical procedures. Honorable Speaker, it is good to note that these services were not offered by the defunct NHIF, which had only 20% of our citizens. Let me go to the Social Health Insurance Fund. Inpatient, what do they provide? Under the Social Health Insurance Fund, in relation to the outpatient care, SHA provides more comprehensive inpatient care with a clear structure for different levels of facilities and longer coverage duration. Honorable Speaker and Senators, critical care service now covered includes, among others, ICU at a rate of 28,000 a night, HDU, and palliative inpatient care. The expanded coverage also include pre-admission evaluation, hospital accommodation, specialist consultation, post-discharge follow-up, and has a limit of 180 days per household. Honorable Speaker, if you compare this with the NHIF, as the member has sought, NHIF only catered for a negotiated daily rebate charge negotiated between a healthcare provider and the NHIF. The patient was nowhere found. It was between the NHIF and the healthcare provider. The NHIF also only covered treatment in government, mission, and some private hospitals, with a limited based on health categories. So the number of health facilities you can visit was limited. Let me come to maternity and neonatal care. Honorable Speaker, in respect of the maternity and neonatal care, SHA offers more inclusive maternity care, covering a wide range of service and ensuring that aftercare for both mothers and child. This package is not only limited to maternal care during pregnancy, but it covers the whole comprehensive package. Honorable Speaker, under SHA, maternity and neonatal care has now been expanded. It has an expanded scope of antenatal and postnatal care that entails how we manage complications, including critical care for both mother and the newborn. It is our moral and constitutional duty that as a country, we, using SHA, we reduce both the death, the maternal mortality of both the mother and the newborn. It has also incorporated services that were under the Linda Mama cover and enhanced it from a delivery of Kenya shillings 5,000 to a reimbursement of 10,000, which constitute about 100% increment for normal delivery and 30,000 for cesarean. Mr. Speaker, just to demonstrate, the honorable members who are members of SHA and who have an extra comprehensive insurance cover given by the Parliamentary Service Commission. The chair, for example, the speaker sitting today, his house girl or houseboy, or his house girl, for example, let me pick that, will go to Pumani Hospital, deliver, 30,000 paid, and walk away without paying a cent, even for cesarean. The speaker, if his wife goes to go and deliver in Aga Khan, SHA will pay 30. His other contribution, medical cover, will pay the 170, because Aga Khan is 200, Pumani is 30. But the same speaker sitting here can also ask his wife to join his house girl to go and deliver, like the rest of Kenya, in Pumwani, and walk out with a baby. So the choice is the same. So we are caring for your house girl, but if the speaker and Speaker Kingi, let me pick on Speaker Wetangula, if they want to, because of equity, they can join our Honorable Sifuna's wife or my wife can go, I'm saying, even the president's wife can go to Pumwani and join our house girls. That is the health care, and that's why we say SHA has brought the element of equity. The choice is yours. You can go to Pumwani or you go to Aga Khan. Honorable Chair, the next question was, also it covers, as per the MOH guidelines, normal and cesarean deliveries, postnatal, and immunization for the newborn is also covered. Honorable Speaker, how do we compare this with NHIF? NHIF cover was limited to only antenatal care, postnatal care, deliveries. It also attracted co-appointment in the event of a complication of a mother and a baby, and it covered only normal and cesarean deliveries, with specific limits for private hospitals. It is good to note that that cover did not include immunization for the newborn. Honorable Speaker, moving on to renal care. SHA renal care includes the management of chronic or acute kidney failure, such as the 3 sessions of the hemodialysis for deserving patients, 2 sessions of these, and 2 others for the prenatal dialysis. This cover only includes the pre-transplant evaluation, dialysis, kidney transplant, post-transplant care, with set tariffs for each service. That's what SHA covers. Comparing this with the renal care under the NHIF, renal care was limited by sessions. 2 sessions covered per week, hence patients requiring 3 sessions and more were required to co-pay. Dialysis and kidney transplant had also set limits per sessions and a package payment for transplant. From the foregoing, Honorable Speaker and members, it's clear that SHA's renal care package, which is found on our website for all Kenyans to see, the benefits of SHA are open, they are public, they are in our website. Our renal care package is more detailed with specific tariffs and services, and they are tailored to a comprehensive patient care before and after the transplantation. I want to report, Honorable Speaker, with your permission, Kenyatta University Referral Hospital, which we are proud of, has done the first 2 kidney transplant 2 days ago. and a good one where there was no organ harvesting. Honorable Speaker, on mental health services. Mental health is an area that I think our country is not serious about it. And I want to make it a key priority for me under the Ministry of Health. But how does SHA covers, or what does it provide for mental health? SHA provides for comprehensive inpatient service in designated rehabilitation centers from the CAFE level 4 to 6. Additionally, services include mental health education, counseling, psychosocial support, and rehabilitation for those who use substance abuse and who suffer substance abuse disorders. Honorable Speaker, compared with the NHIF package attracted co-payment. They were not paying for anything to do with the mental health. They were asking you to pay. And it had limited coverage in specific contracted facilities for rehabilitation of drug and substance abuse. Honorable Chair, SHA mental health services are broader, they provide more holistic care, and they cover a wide range of mental health issues, both under outpatient and inpatient. Let me go to oncology services, which is very critical to our country. Honorable Speaker, under the oncology services, under SHA, the treatment will follow the treatment care plan prescribed by the oncologist in line with the National Cancer Control Program guidelines. So after when we treat you, we still follow you with the post treatment plan. Comprehensive cancer care, including chemotherapy, radiotherapy, surgical intervention, and routine laboratory investigations with specific tariffs will be provided. Under the former NHIF, oncology services were limited in terms of amount and sessions and attracted co-payment. It also only covered radiotherapy and chemotherapy with set limits per session and per cycle. Honorable Speaker, SHA provides a more extensive oncology package with clear tariffs for various procedures, making cancer treatment more accessible and more predictable for our patients. On surgical services, under SHA, SHA will cover pre-operative, intraoperative, and post-operative care, including major and specialized surgeries, with set tariffs for each procedure type. Under the former NHIF, it only covered major, minor, and specialized surgeries, with the set packages limits depending on the level of that hospital. The package also attracted a co-payment. To this end, Honorable Speaker, SHA surgical services are more detailed, more structured, providing clear guidelines and tariffs, which enhances transparency and accessibility for patients. On dental services, SHIF also covers dental services which include consultation, preventive and restorative treatments, such as extractions, scaling, and management, while NHIF dental services were only limited to tooth extraction. In this regard, dental services are more broader under SHA and includes a wide range of treatment. On the third one, on emergency, chronic, and critical illness fund, Honorable Speaker, under SHA covers medical and surgical procedures not available locally with a limit of 500,000 per person, whereas under NHIF, a similar coverage through reimbursement for overseas treatment up to 500,000 subject to approval was offered. SHA's structured approach with specific tariffs for different treatments shall ensure better planning and access to necessaries abroad. On emergency treatment, Honorable Speaker, SHA emergency treatment shall be accessible to all Kenyans. Under NHIF, emergency treatment was only accessible to be paid by NHIF members. SHA offers a more comprehensive cover. Critical services, SHA, the critical services include care for admission in intensive care unit, high HDU, and NCIU, unlike NHIF. And all this include even the band units. The critical services were not covered under NHIF. SHA offers critical care package, including specialized services and broader coverage which enhance the safety net for health conditions. Honorable Speaker, under SHA, that's emergency evaluation, SHA accidents. Under SHA, accidents and emergencies are paid for all Kenyan residents under the Emergency, Chronic and Illness Fund. Under NHIF, emergency evaluation was limited to road ambulance service through contracted providers like Kenya Red Cross. Honorable Speaker, let me say this very clear, and many people don't know. And members have been aware that in the event you are walking in the streets and you get a stroke or you get an ailment, when you are rushed to a hospital, the first thing they used to ask you under the former NHIF was deposit. Under SHA, under the emergency, you are rushed to a hospital, that hospital will admit you, will treat you, and will release you out, and you don't pay anything. You even don't need to register. And I'm sure many members will agree with me that there are many Kenyans who die when the ambulance is going round looking for a cheap hospital that can take a lower deposit. These SHA benefits now for emergency, chronic, and critical illness fund will make sure that in any emergency, any hospital must admit, treat, and release that Kenya. And I want to assure this House that if any hospital will do contrary to what SHA provides and the law you have passed, I will have no other reason other than to close that facility. Honorable Speaker, in summary, I think the member has the key achievement of SHA benefits. These benefits are found in our websites. Kenya has made largest step in achieving of universal primary health care service for all Kenyans, and it's important to know that 70% of the health burden are at the primary care in nature. They are at our villages. They are in the rural part of Kenya. And that's why this House and government decided that the primary health care must be free. We have a comprehensive coverage. Under SHA, you have more inclusive, more detailed benefit package. It covers a wide range of medical conditions, procedures, and services compared to NHIF. The SHA structured tariffs, they are structured. SHA provides clear tariffs for various services. It has enhanced transparency and predictability for members when assessing the healthcare services. Number 4, Honorable Speaker, user-centric policy adjustment. SHA includes specific benefits and processes such as re-registration of members and structured penalties. Honorable Speaker, even we are focusing more on preventive care. SHA emphasizes on preventive care, including health education, screening, early detection, aligning with the long-term health outcomes. We must, before we were dealing with the other aspect, but this time SHA says it's focusing on preventive. And then lastly, and second lastly, better access to specialized services. SHA gives you more specialized care options, such as mental health care services, oncology, renal, providing members with a better access. We are also have a comprehensive emergency and critical care. Honorable Speaker, on the question of the justification for the mandatory migration of NHIF contribution to SHA and any other measures put in place. Honorable Speaker, if you agree with me, when I was looking at this question, I asked myself, why should I answer? Because it is this House that created the law of Social Health Authority Act and Social Health Insurance. And in the transition clause, what you are doing, you are making NHIF redundant. So at that stage, you should have asked, why are we transiting But because I have to answer questions before the House, I have to do it. Yes, I have to do it. But now that I am on this side, I think Honorable Jende should have, Senator Jende should have asked this question when we were passing the bill, and now which is an act. But Social Health Insurance Act repealed the National Health Insurance Fund. And with the repeal, all the obligation and assets of NHIF were moved to Social Health Authority, as provided for in the Social Health Insurance Act. And the effects of paragraph 2 and 3 of the first schedule to the Act 23 was to vest all its assets, rights, duties, and powers of NHIF in the authority, which assets include NHIF database. So therefore, Honorable Speaker, to ensure that timely and seamless access to health benefits of the beneficiaries of the defunct NHIF, the authority mandated through a legal notice number 147, published on 20th September 2024, for the transition of members of the National Health Insurance Fund, including our honorable members here, under the repealed NHIF Act. They all transited to Social Health Insurance Fund upon verification of their data by the authority using existing relevant database. Honorable Speaker, the information was transferred to ensure that all these members and their declared benefits can access benefits come 1st of October 2024. The transition of the information was in the interest of the members. Secondly, Honorable Speaker, Section 28(2) of the Data Protection Act provides that data may be collected indirectly from the data subject, where collections from another source could not be prejudiced in the interest of the data subject, where the collection data from another source is necessary. So, Honorable Speaker, if I go to the question that the Senator sought clarification on the measures put in place to guarantee comprehensive year-round.
CS, have you concluded with the two questions by agenda?
No.
Because of time, I would prefer that you move a little bit faster. Because we already have the responses.
Honorable Speaker, you know the Senate.
And also, yes, I was actually having difficulty to follow your response because we don't have that additional information you're giving.
Honorable Speaker, this document I photocopied, I have signed, and I have given to the House, to the relevant House, to the Senate, and some members have.
Cabinet Secretary, I'm being informed. Cabinet Secretary, order, senators, order. Cabinet Secretary.
I can leave this also with the House.
Cabinet Secretary, I'm being informed that you actually signed this response that you have.
Yes.
When you were in the House.
Yes.
So it has not been distributed. So what we'll do is we will stop where your response is, that the copy we have, and go to the supplementaries, and maybe that issue will come up.
But Honorable Speaker.
Honorable Senators.
Honorable Speaker, for your guidance, and I abide by your ruling, the House has 3 different methods. The House can call me to a committee. The House can tell me to send a written statement to the clerk. And the House can tell me to come to the plenary. And now I've been told to come to the plenary, and it will be very unfair if you cut me short. And I'm not only talking to the senators, I am talking to the people of Kenya through you. If you allow me to finish the question, and then maybe I take the supplementary. I don't know whether the Senate is in a hurry, but me, I'm not in a hurry.
Cabinet Secretary, we are not in a hurry.
Yes.
We are just running out of time.
So,
and there are 2 more questions for you to reply to.
I can take the next